Community health centers have been trying to bridge divides in access to care for more than half a century. During the COVID-19 pandemic, as health centers make adjustments and meet financial challenges, that mission has become all the more urgent. To tell us about that mission at Fenway Health and its focus on needs of the LGBTQ community is the center's new CEO, Ellen LaPointe. Thank you very much for being with us, Ellen.
Thank you so much. It's good to be here, Chris. Thanks.
Well, as if all these changes were not enough, you come in, March 9th as the new CEO. What was that like?
Well, it was quite a day to come in. Certainly, I can tell you this. Within 3 hours of my arrival in the front door on my first day, we had to cancel our one of the major fundraisers we do every year, a community event called the Men's Event. That was actually my first official act at Fenway Health. And it kind of went from there. Of course, as you know, and we all know, that was the week when things really escalated everywhere in terms of making sense of how quickly we all had to act to reduce community spread in Massachusetts and Boston, in our institutions and so forth. So I was immediately sort of implicated in all of the things that had to happen to convert our effort here, the care and services we offer at Fenway Health, to an almost exclusively telehealth setting. So that was the first thing that sort of we dealt with. And of course, doing so in a context where every employee, every staff person, everybody we work with, our patients, our board, our donors, are all very profoundly impacted at the same time. So maintaining a sense of community and purpose and really keeping folks aligned and clear that we are here and not going anywhere through that initial stage of the pandemic crisis was sort of the work at hand. And we've continued to pace, of course, since then.
Well, going back even 2 or 3 months ago, we had heard from the Fenway Institute that there was a health disparity affecting the LGBTQ community in connection with COVID-19. But I think since then, you've probably noted there's also an overlap with racial disparities. So how does that happen exactly?
Well, certainly those things are both true and to a degree related. I mean, we see a host of what are often referred to as intersectional impacts in communities that are subjected to intentional systemic exclusion and oppression. And so Black, Indigenous, and other people of color, LGBTQIA people, women, all are going to suffer disproportionate harm whenever there is something like a pandemic that comes, because they've already been experiencing reduced access to care, increased risks for adverse health outcomes due to other issues that sort of they confront on a regular basis. I should say we. And so you will expect to see these disparities, and you'll expect to see these exacerbated harms. And so Fenway Health has been very focused on that since the beginning. If I may, the death of George Floyd at the hands of a white police officer in late May was another event, a tectonic event, and a very impactful event that again sort of brought forward what is now commonly thought of and referred to as another pandemic that's been with us a lot longer, and that is of systemic racism and the sort of ongoing impacts that has on the opportunities that people have to live well and prosper and thrive in community and with their families. So both of these pandemics, while unspeakably difficult and challenging, I think afford us all an opportunity to kind of really consider how we need to transform ourselves in order to overcome these issues and barriers that have been with us all along.
Well, you've mentioned that you've done some more serious thinking about overcoming barriers, creating more inclusiveness. Before, I think the word we often use in connection with that was creating a safe space. You prefer creating a brave space. What does that mean exactly?
Sure, thank you for that. So we don't speak of it as safe space at Fenway Health because we can't by decree decide that space is safe for anyone. Safety is something that is experienced as an intensively personal matter. And so it's presumptive, frankly, to assume that spaces we make are safe for everybody in that room. So it's, well, perhaps a subtle distinction in the language. It is intended to mean, to sort of signal that our goal is to create space where we're all trying to create the conditions where we can take risks together with shared agreements and understandings about how to engage with one another supportively, which isn't to say that we go easy on each other, to have hard conversations, but to do so in a way that invites courage and bravery, even if it doesn't always feel safe potentially.
Well, one of the other disparities that lots of health centers have to deal with is the difference between people who have robust health insurance because they have good
Yeah.
jobs with good pay, and people who don't. I mean, and that, I guess the latter applies to some of the people you have to help too, right?
That's right. So we have a blend of patients here. We provide care without without regard to ability to pay. Certainly, anybody who walks into the door at Fenway Health will be cared for. That's for sure. Some of our patients have private insurance, and some don't. And again, that's not a barrier here. To everybody gets the same consideration and attention and care, regardless of that the source of their payment, or even whether they can pay. But typically, when you see someone who has a reduced ability to pay, they may lack third-party coverage. That may suggest that they are dealing with a host of other challenges in their life, around employment, around housing, access to education for their kids, food security, any number of things. There might be substance use issues. So part of what we were also here to do is to try to connect folks in an integrated way to services and care that they need that are not necessarily the healthcare side of things, in order to kind of meet them as a whole person. We have a robust behavioral health program as well that is really putting a lot of really exciting effort into trying to really meet patients where they are. If I could use just one example, in one of the big challenges in the early days of the COVID crisis, when we had to switch to telehealth, was that people were not able to access, things that they need, and in particular, for example, gender-affirming surgeries. So the behavioral health group put together a virtual meeting space for gender diverse and trans folks who needed to come together and talk about their challenges. This is really important in times of trauma and crisis, which is exactly where we are right now globally. So I think that's an example of the kind of thing where you're looking always to sort of meet people where they are and as whole people.
And where they are, I think that could mean a lot of them are more cut off from their social support networks too.
I think this entire pandemic has served to exacerbate existing challenges with isolation, with access to technology. We haven't mentioned yet that, for some number of people, sheltering in place, which sounds great if you can get it, right? Some people don't have a place to shelter safely. They may have a home, but it's not necessarily a safe one. They may not have secure housing. So, looking at that holistically and trying to find supports for folks is part of what we try to do here. We don't provide all of those services. We do some of it, but certainly our goal is to help connect people to community services when they need it.
Well, going back to around Pride Week this year, President Trump announced a new set of rules that would basically eliminate anti-discrimination language in the Affordable Care Act that had to do with either sexual orientation or gender identity.
Right.
The Supreme Court stepped in later with a ruling on workplace discrimination. So how do those two add up together? What do you see happening as a result now?
Sure. Well, let me break that down a little bit. So yes, you're right. The Trump administration, HHS, recently announced that they're putting in place a rollback rule that essentially will strip the Affordable Care Act of multiple protections that are currently in place to support and protect from discrimination LGBTQIA people and trans people and gender diverse people. So it's as you describe, it's an affirmative act. It's an intentional act to take away protections that have been in place since 2016 or so. The Supreme Court case that you're referring to that happened in June, Bostock, I think is the name of it, was a very strong decision that affirmed that discrimination against folks who are LGBTQIA, trans, gender diverse, constitutes sex discrimination for purposes of Title VII, employment law. And the sex discrimination, as we know, is prohibited under the U.S. Constitution. So it basically was a very strong finding, an affirmation of something that medical organizations and the Equal Employment Commission for years, 15 years, have been affirming over and over again that these things are related and need to be treated the same. And so we're pleased with that outcome, but it was specific to employment law. And so now this rollback rule that is happening around the ACA essentially is attempting to do the same thing in another context, which is why we filed, along with other colleagues of ours, recently a lawsuit to stop the Trump administration from doing this, to stop that rule from going into effect. And I know we'd want to talk about that a bit more. The thing I would just offer at the outset is this didn't happen out of the blue. This was something that the Trump administration had signaled it wanted to do. They had placed it in the Federal Register. They had invited public comment, and they received well over 100,000 comments from members of the public all over the country, overwhelmingly indicating that this would cause enormous irreparable harm to people. And this rule was put into effect without regard for those comments, without addressing those comments, and without any reference to the Supreme Court decision that happened in June. That's quite on point and very significant for this matter.
Well, and of course, it shows once again part of the health center's mission is legal advocacy as well. We should mention that if anybody needs any help or wants to get more information about what you're doing at the health center, is there any way they can follow up on that?
Sure. Just find us at fenwayhealth.org. I mean, that's really the easiest thing. And there's all kinds of information there about how to become a patient, how to get involved with advocacy work, how to engage in a host of ways as a donor, as a community supporter, and so forth.